Can Klonopin help with OCD, leg shaking, anxiety, and panic? I'm Dr. Anthony Claudio. I'm a board-certified psychiatrist. And in fact, Klonopin and benzodiazepines are probably one of the most common medications I'll prescribe in my clinic, in particular because so many people find them helpful. And many other doctors, like primary care doctors, internal medicine doctors, ER physicians, they may start the patients on it and not want to continue it, or they may see patients on this and not feel comfortable with continuing it. So they refer to a specialist like a psychiatrist such as myself to continue these. So in regards to this question, I'm going to take piece by piece because each condition you're describing can be treated by Klonopin, but there are other medications that may be better or other approaches even medically to assess it. OCD. Now, nowadays we think of OCD as either intrusive thoughts, recurring intrusive thoughts, or it can be compulsive behaviors, basically repetitive behaviors that one does to help ease tension they feel. Now, talk therapy can help with OCD, but often it does need medications to help alleviate people's symptoms. You can do the combination of the two. Usually the combination is the most effective, but almost all people with OCD do need medications to help. And the most common medications, or at least the first line medications that are recommended to treat OCD are the SSRI medications, like Lexapro, Zoloft, Prozac, medications in those class. There's other medications that are more specifically tailored to OCD that can be helpful. Fluvoxamine is one, also known as Luvox. That can be helpful for OCD. Clomipramine is another that can be helpful. And sometimes OCD can be so hard to treat, even at maximum doses of SSRIs, that antipsychotics are added to help with the symptoms. Now, Klonopin can be very helpful for anxiety, to calm down the mind. It can help with behavior management. So I'm sure it can be helpful to be used in OCD, but due to the possible side effects of Klonopin, it's not going to be the first medication that people recommend because there's many other approaches that can be helpful. Now, leg shaking. Leg shaking can be a sign of anxiety for which Klonopin can help alleviate, but maybe it's something else. Is there pain? Is there muscle spasms? I don't know, is there an anemic condition going on, a thyroid issue? Leg shaking is a really non-specific symptom. And so if it happens like at night where someone gets restless legs, then maybe they need to be worked up further, like for anemia or low iron or something. And then the treatment for like restless leg syndrome will be something totally different than what Klonopin adds. Are you on any medications that can cause restlessness or leg shaking? Like antipsychotic medications can cause this. Anxiety. Yes, Klonopin can be useful for anxiety, but it's usually used only for short-term or extreme episodes of anxiety. If anxiety happens like longer than 6 months, longer than 12 months, then Klonopin is usually not recommended because it's not typically recommended to be taken that long. But also there are many causes of anxiety. That's why it's important to have a full evaluation with your doctor to see if there's other things that are causing anxiety. Are you having too much caffeine? Are you using drugs like smoking? Are you drinking alcohol and maybe there's alcohol withdrawal that's causing anxiety? So these are some things that you have to tease out to really know if it's what the anxiety is from or if there's anything causing it. But generally speaking, people with a family history of anxiety are more likely to have anxiety. And what treatments work in certain family members are more likely to work in some of the others. Now, panic. Klonopin can be helpful in panic, especially in cases where panic disorder can get so severe where people are afraid to leave the house or go to public places because they're afraid that a panic attack will happen. And so that's really one of the most common indications where I will recommend or I would be willing to prescribe something like a benzodiazepine long-term is when people have these severe episodes of anxiety where they're afraid to leave their house or go into public places, because medications like this will really help their quality of life. But again, you want to do a thorough evaluation with your doctor and make sure that there's no underlying things that are causing some of these symptoms that you're reporting. Hopefully this video was helpful. Be sure to like the video for more videos like this one and subscribe to the channel to help support the channel. Thank you for watching.